Birth and the Newborn Baby by Serene Lee. Stages of childbirth. Contractions signal the beginning of childbirth, though there is also something called Braxton Hicks contractions. Here in a couple slides, I'll actually post the differences between the two because Braxton Hicks are not regular contractions. Childbirth occurs in 3 stages. First stage, labor. There's 3 phases of the first stage. We have early labor, which is until the cervix is dilated to 3 centimeters. Active labor continues from 3 centimeters to 7 centimeters, and transition, which continues from 7 centimeters to 10 centimeters. In the first stage, contractions efface, which is thin out, and dilate, widen, the cervix, which needs to widen to 10 centimeters. Contractions usually start out less painful, pretty spread out, and don't last as long. As the process continues, contractions become more powerful, frequent, and regular. Women are advised to go into the hospital when contractions are 4 to 5 minutes apart. End of the first stage is when women are in a labor room, and this is the longest of all 3 stages. So we have our first picture, which says Braxton Hicks versus labor, which is what I was kind of talking about. The contractions for Braxton Hicks are regular pattern and will go away. And if you change your activity, walk or lie down, they'll actually go away. So they're not considered actual contractions. And then on the other picture, the one on the right, that's actually a real contraction, and those accels are when the contraction is happening. Kind of looks like a mountain. The second stage, which is birth of the baby, begins when baby appears at the opening of the vagina, also known as the birth canal, ending with the birth of a baby. Contractions in the second stage stretch the skin surrounding the birth canal further and move the baby along. Once crowning, which is also another word that the baby is right there, right at the opening of the birth canal, happens, baby normally emerges in minutes. Tears can happen. Also an episiotomy, which is a cut from the vagina to the anal cavity, and that usually happens if the baby's shoulders are too wide or they get stuck in the birth canal. Can also happen during this stage. Once the head emerges, mucus will be suctioned from mouth and nose to prevent obstructions for breathing. Umbilical cord is also cut in this stage, and the stump of the umbilical cord will dry and fall off on its own within 7 to 10 days. Here I just have 2 pictures. One is of a woman going into labor, and the other one is the stump of the umbilical cord. After they cut it, they actually clamp it down with that plastic piece there, and then it does just dry out actually pretty fast with both of my boys. It happened within 4 days, which was a little scary because I didn't expect it to happen that soon, but it does dry out very quickly. Third stage, delivery of placenta, also known as the placental stage. During this stage, the placenta separates from the uterine wall. You will continue to have mild contractions that are close together and less painful. You'll push one final time to birth the placenta. Your doctor will examine placenta to make sure it's all intact. Any remaining pieces must be removed to prevent infections. After delivery, the uterus will continue to contract to help return it to its normal size. And during this time, your doctor will determine if any stitches are needed and fix them up. This is actually the end of the 3 stages. You'll actually be able to enjoy your baby in peace and quiet without all the doctors and nurses in your room. We're excited.